We're pleased tonight to present physician, scientist, and activist Dr. Mona Hanna-Attisha in support of her landmark new book, What the Eyes Don't See, the story of crisis, resistance, and hope in an American city. Dr. Mona will be joined in conversation this evening by Chris Kolb, President and CEO of the Michigan Environmental Council. Literati would like to take this opportunity to thank those who have helped make tonight possible. First, our thank you to Amy Novak, Director of Special Events for the School for Environment and Sustainability. This event simply would not have been possible without the involvement of the School for Environment and Sustainability and without Amy Novak's organizational prowess, all during Welcome Week in the first week of classes, no less. So thank you also to the staff and volunteers from the School for Environment and Sustainability for assisting us tonight. Thanks to Shannon Rice of University Productions and the staff here at Rackham, Larry, our house manager, and Don up in the booth, as well as our ushers this evening. And finally, thank you for being here. Your support of these events and books like What the Eyes Don't See make these programs possible in our community. Speaking of books, Literati has copies for sale in the lobby, which many of you have already purchased. Dr. Mona will be signing this evening. We want to keep this process efficient and orderly and avoid overcrowding the lobby. So following the Q&A, if you will not be getting a book signed, you're free to go out into what promises to be a pleasant late summer evening. But if you would like a book signed, we invite you to stay seated in your seat, and volunteers will release you by row or approximately by row up that aisle and into the lobby to have your book signed. Also, volunteers will be present to put the name you wish to have the book made out to if you want your book inscribed on a Post-it, and affix that inside your book as well. And if you don't yet have a book, please feel free to purchase one while they last in the lobby, and then come back and take your seat. Was that all I had? Oh, yes. Note also tonight that the School for Environment and Sustainability will be live tweeting this event with hashtag UMichTalks. I'd now like to introduce Dorceta Taylor, who will be introducing Dr. Mona. Dorceta Taylor, PhD, is James E. Crowfoot Collegiate Professor of Diversity, Equity, and Inclusion at the University of Michigan School for Environment and Sustainability. A leading scholar in the field of environmental justice, this year alone, Dr. Taylor has been recognized with the Presidential Award for Excellence in Science, Mathematics, and Engineering Mentoring by the National Science Foundation, the Freudenberg Lifetime Achievement Award by the Association of Environmental Science and Studies, the Women in Conservation Rachel Carson Award by the National Audubon Society, the President's Award by the Detroit Audubon Society, and the Distinguished Faculty Achievement Award by the University of Michigan. Please welcome Dr. Dorceta Taylor.
Thank you. It's great to see so many faces here tonight. On behalf of the School for Sustainability and Environment, Dean Overpeck, the staff and faculty of SEAS, or New School, I would like to welcome you to this, and I look forward to the next hour and a half, 2 hours that we're going to have. It's going to be a special evening. Definitely nice to see so many folks out on a very nice, early, almost fall afternoon. Given how the weather has been, it's been nice to see so many of you taking the time to be here. I want to thank Literati, all our other partners, School of Public Health, but more so, again, the faculty of SEAS. Many retired faculty members are here, many former students and current students. Program in the environment, good to have you back in the building. It's great to go in and not see an empty seat in the building anymore, because now we have all the undergraduates there. We would like just to take note that this is the second event 2 nights in a row that we've had about Flint and the Flint water crisis. Last night, many of you were treated to the event of the movie Nor Any Drop to Drink. This is a documentary film that had a wonderful panel discussion. I wasn't able to go, but I've heard the students talking about it, and I'm sure there will be further chances to engage that as we go along. Our school, SEAS, formerly School of Natural Resources and Environment, has been engaged and involved in issues with Flint for quite a while. Many of you who were around in the 1990s remember the incinerator struggle that was in the wider Genesee County. Faculty and students were quite engaged in that. Several faculty and students also have been involved in food justice, urban gardening, agriculture issues in Flint, and many of the students have, for the past 2 years, been involved in things like water delivery and other service activities in and around Flint. And of course, the larger conversations around environmental justice. The school has been very engaged in that for several decades in Flint, in Southeast Michigan, and in areas in other parts of Michigan. I won't take much more time, but tonight it gives me great pleasure to welcome 2 of our alums from SEAS who are going to have a conversation with us around the water crisis. The 2 alums are Dr. Mona Hanna-Attisha and Chris Kolb. Interesting when you say the right words. People actually. Chris Kolb, who earned his bachelor's degree from SEAS, was one of the earliest students there to study the whole emerging nexus of concentration around environment and social justice. He is currently the president of the Michigan Environmental Council, and that's a statewide coalition of over 70 environmental, public health, and faith-based nonprofit organizations and groups. Before joining MEC, the Michigan Environmental Council, Chris was represented in Ann Arbor in the State House for 6 years. He served 6 years in the Ann Arbor City Council, so if his name sounds familiar, you might have seen some of those yard signs. I think there was some on my lawn at some point. Before joining, he also is the president of MEC for the past 7 years and has more than 12 years of experience in environmental management. He served also as a co-chair of the Flint Water Advisory Task Force and is co-chair of the Governor Snyder's Environmental Justice Working Group. He will join Dr. Mona in a conversation, and that leads me to introduce Dr. Mona Hanna-Attisha. And she earned her bachelor's degree also from SEAS. She won't say what year, but you can get that out of her in Q&A. Mr. Kolb also won't say what year. And you might also be able to get that out of him in Q&A. She earned her master's degree from the School of Public Health, and she is, yes, she's schizophrenic, so she wears green, and you know which school that is, and maize and blue. She does both, multitasking always. She is now the director of an initiative to mitigate the impact of the water crisis, and her new book, which is going to be the focus of the conversation tonight, the title of the book, What the Eyes Don't See, A Story of Crisis, Resistance, and Hope in an American City. She has been called on to testify before the U.S. Congress, not about her tax returns or anything like that, but about the water crisis. Right, or her birth certificate. She was awarded the Freedom of Expression Courage Award by PEN America, and Time magazine has identified her as one of the 100 most influential people in the world. With that, I'll exit stage right, and I turn you over to Mr. Kolb and Dr. Mona Hanna-Attisha. Thank you.
Thank you. So I'll explain a few things. Anyone who knows who Andy Cohen knows, he uses cards, so I figured if Andy can do it, I can do it. And then two, I had to prove, Mona said the one thing you have to do is read my book. So I had to prove to her that I actually did with all my sticky notes on there. So I love props, they help me out. And the one thing we didn't talk about is how we're going to start this. So I'm just going to, thank you for letting me be a part of this great event here at U of M in partnership with the C's, the new name of our old school. And it's interesting because when I read your book, it's different from my perspective in that I came into the Flint water crisis on the back end. You'd already had your press conference. You'd already proven that the children were impacted by lead in the drinking water. The state had capitulated and said, yes, you were right, and that children were harmed. And we did the review of what happened and why and made recommendations. So I knew this from the back, from the end, backwards. While reading your book was fun for me because I got the perspective of it going forward. And it was interesting because so many people in your book I know,
Absolutely.
I interact with, whether they're elected, state officials, or even some of your old high school buddies are friends of mine. So that was really fun for me. And so once again, I just appreciate being here. And I'm hoping to take this kind of an arc of your book. And so I'm going to start at the very beginning with the title.
Yeah.
And why did you choose that title? What the eyes don't see.
So I think there were about 8 pages of possible titles for this book. Writing a book is very difficult, and I don't think I would do it again. It's a long process, and just that title took quite a bit of time and quite a bit of thought. And I finally settled with the title, What the Eyes Don't See, because it means so much, and you can take it in so many different ways. It is the quite literal. We do not see lead in water. It is invisible, it is odorless, it is tasteless. Our eyes do not see lead in water. We also do not see the impact of lead. Lead in pediatrics and public health is known as a silent pediatric epidemic. We do not see the consequences for years, if not decades. I ask my medical students and my pediatric residents, like, how does a child with lead poisoning present? And they'll be like, oh, he's got a headache or a stomach ache or he's doing problems in school. I'm like, no, none of that. They're asymptomatic. We do not see what this neurotoxin does. So that's kind of the quite literal. But the title means so much more, and it goes way beyond Flint. It is about people, it is about places, and it is about problems that we choose not to see. As you go through this book, for about 1.5 years, I was also very blind to what was happening in Flint. I was telling my patients that everything was okay. I was drinking the Kool-Aid, that the water was fine, and that it was fine for the kids to drink. So it is about all of us being blind to injustices that are happening all around us. But the book is very much also a rallying cry for us to open our eyes, that we can be awake and alert to these issues, and we can act on them.
I thought it was interesting because you also point out in your training of your residents that you impact upon them to get out into the community to see what your patients live, what's their environment, what's their social condition is. And your teacher, is quoted saying, how can your eyes see something that your mind doesn't know? And so I thought it's great how you've wrapped just the title with lead, with the medical training, and what's out there that we really don't see. So I thought it was a fascinating title.
And the book, especially in the beginning, goes through what it means to practice pediatrics. So I know there's some pediatricians in the audience. Where are all my pediatricians out there? Oh, there's a lot of pediatricians. Yeah, you guys are awesome. Or medical students. So So in pediatrics, probably more than any other specialty, it's all about the whole child and their whole environment, and especially those of us who are in general pediatrics who practice something called community pediatrics. So much of what influences the outcomes of a child's life is not medicine. It's not the antibiotics I prescribe to the kid. It's asking whether they have safe housing, they live in a, in a violent community, if there's domestic violence, if there's clean water to drink. It's all of these other social, economic, environmental influences that influence the lives of the patients we treat. So it is an awakeness to these larger issues. And yeah, it's important to screen for hearing and vision and blood pressure, but we really also need to be screening for poverty and food security and all these other issues.
Cool. So I also found it interesting that the book begins with family and it ends with family. And you really weaved your family through this book and history as well. So why was it so important that you do that? Especially I thought your family's experience in Iraq, from your grandparents to your parents, to your family as it is. And do you think that helped prepare you for what was coming?
Absolutely. So this book is not just a Flint book. I think if I would have written just a Flint book, it would have been the easy thing to do, and I like to take risks. I'd like to do things that aren't easy. So to know my role in this story, in this crisis, to understand why I do what I do, you really have to kind of get to know who I am and where I came from and kind of the values that rooted me. So this is a memoir. It's merged with a lot of that family history and that background. And it's also an immigrant story. And I don't think it would have been an immigrant story as much if it was not for the last presidential election. I wanted people to hear and to see an Arab American that is not associated with terrorism or wars or bans or what have you. And that's critical to who I am. So we came to this country when I was 4 years old. We're Iraqi American. We were fleeing the tyranny of Saddam Hussein. So at that time, he was rising in power. The Iran-Iraq war was about to start, where 1 million people would die. And my parents knew that this was not what they wanted for their children. So we left that oppression, we left that fascism, we left that tyranny, that dictatorship, and we came here to the States. And we came here for opportunity and freedom and democracy and for that American dream. And that was absolutely realized for me and my family. So I grew up in this country every day grateful to be in this country. But I also had the perspective of acutely knowing what injustice could be. My parents, who are over here, they never shielded us growing up from what was happening back home, and shared stories of back home. And it's in the book, but I clearly recall when I was about 11 or 12 years old. And this was before anybody knew about Iraq and nobody knew where it was. And my father would be digging through reports from like Amnesty International or Human Rights Watch and listening to a shortwave radio, what was going on. And he shared with me what happened in a town in northern Iraq, in Halabja. I don't know if anybody's aware of Halabja. Halabja was a city in northern Iraq, a Kurdish city, where Saddam Hussein literally poisoned an entire city. 5,000 people died that day. It is to date the largest chemical weapons attack in history. And I remember very vividly seeing a picture of a beautiful baby in a pink blanket, lifeless on the street, nestled by her father, who was also lifeless. And that was the milieu of my childhood, knowing what people in power could do to vulnerable populations, being every day fortunate to be here, and really pledging my career and the energy and the work that I could do to serve and to fight for justice, no matter where that may be.
You also talked about and we don't have to dwell on it, but you also brought up other historical figures from the public health field, including your distant cousin.
Yeah.
That I thought was really good. And I got to admit, when I first started reading the book, I was like, when are we going to get to Flint? I want to get to Flint. And by the end of the book, I'm like, I want to hear more stories.
Yeah.
I want to hear, more things about your life, because we are very ignorant in this country of other parts of the world. And you brought that perspective that I thought was really, really important. And, you tied it in, for me particularly, about your discussion on the keyhole rule versus the precautionary principle, and how central they were really to your telling the Flint story, but also when we think about it, how we in this country deal with environmental health and environmental regulations when you really have to prove something is bad instead of proving it's safe.
Right, right. So there are a lot of stories and there's a lot of history in this book. And it's not like boring history. So Oprah put this book on her summer reading list and she said it was a gripping, Grisham-like thriller or something like that. So it's exciting history and page-turning history. We have to know history. We have to know where we came from to know where we are going. So there's the history of lead in there. And the history of lead is absolutely evil. It's an evil history where, you know, it was driven by profits, it was driven by greed, and it was anti-science. There was a denial and the attack of science. And a lot of that was based here in Michigan where Kettering put lead in gasoline in the 1920s, tetraethyl lead, despite the heroic activism and work of actually a woman, one of my heroes, Alice Hamilton, who did her medical school training here at the University of Michigan. In the 1920s, she was the nation's expert on lead, and she was a physician. And she fought him with everything she had, but industry won, because General Motors had a patent on tetraethyl lead. So there's a lot of history. There's a lot of Flint history and the public health history throughout this book because it absolutely resonates to what's happening today. So you talked about the Keyhole Paradigm. So during the fight to put lead in gasoline, so right now we have unleaded gasoline, which is really funny because lead was never in gasoline. We added it in gasoline, and then we took it out. The Keyhole was one of the industry hacks, an industry expert hired by General Motors to push lead in gasoline and to dispute the effect of lead in gasoline. And his persistence and his power and really the power of industry created something that is anti-public health, anti-environmental health, but it laid a precedent known as the Keyhole Paradigm that we have to prove something is harmful before we will do anything about it. And that was really set in the 1920s. And that is contrary to common sense, but it's contrary to public health and the principles of public health, and especially that of the precautionary principle, which is really to err on the side of caution. And lead is a perfect example. So now for lead, we know that we have to do something called primary prevention because it has no safe level. What we're supposed to do is to make sure that children are never exposed to lead. But we often fail to do that, and we're often reacting after children are exposed to lead.
Thank you, because it actually came up in a meeting with the Mott Foundation the other day, and I was able to pull that out, talk about it, and sound like I knew what I was thinking about. So thank you. Tonight we have a couple special guests here. I mean, you have your parents here, and I know your family. But we also have Bunyan Bryant and Paul Mohai, who are both here. I want to say hello to them. And Bunyan's wife, Jean Carlberg, who served on city council with me and is one of my favorite people in the world. But both of them, Bunyan and Paul, were really touchstones for you and I, both here at U of M and throughout our lives. And I wanted to really start thinking about sort of how you framed this book as well, about the social and economic disparities. They're really important, components of public health and of the Flint water crisis, and how your education, particularly here at U of M, helped you to see the world through those types of lenses.
Yeah, so my path to medicine, I would say, is probably atypical. So I started out as an environmental activist. So I started out as a high school student who got connected to a local community fight. We had an incinerator by our house in Madison Heights that was about to reopen. It had been open for decades. The kids in that neighborhood had higher rates of asthma. Adults had higher rates of respiratory problems. So as a high school student, I couldn't even drive. My parents would drop us off to protest. Have fun, don't get arrested. We got involved hand in hand with a community organization, and we door knocked and we protested, and we made sure that the incinerator didn't reopen by electing another former SEAS alum, another former student of Bunyan Bryant, John Freeman, to the state legislature, who eventually closed down that incinerator for good because it was operating so close to an elementary school. So that experience in high school gave me this really early flavor of what the impact of the environment can have on health, the role of policymakers to improve our community and our health. And so I came here to the University of Michigan to the School of Natural Resources because I wanted to continue my work as a tree-hugging environmentalist, and that's exactly what I was. And then I got involved in service learning while I was here. I was on the founding board of the Center for now the Ginsberg is a center, then the Center for Community Service and Learning. Did a lot of advocacy, voter registration work, but also did a lot of hardcore research. Paul Webb, I don't know if you're here, I know you're here somewhere, another one of my early mentors. We spent a summer in Drummond Island collecting water samples. I went to the biostation, the University of Michigan biostation. I went to University of Michigan's Camp Davis out in Wyoming and took a geology class. Did research in the School of Public Health with Dr. Locke Caruso in reproductive toxicology. So did a lot of hardcore science. So my hardcore science training was born here and developed here, but also began to realize the connections and the greater connections between environment and health. So created my own major in the School of Natural Resources in environmental health, and then went on to medical school. But it was in that time here as an undergrad that I also was influenced by the early leaders of the environmental justice movement. So in Flint, over the last couple of years, people would come up to me like, have you heard about this concept called environmental justice? I'm like, oh my God, 20 years ago, I was taking classes from Professor Bunyan Bryant, where he would tell us that, this is the research, this is the science, these are the studies where time and time again, people of color, people who are poor, are disproportionately burdened by environmental toxins, by environmental pollution. So I have been so blessed and so fortunate to have these amazing mentors who have really kind of put me where I needed to be, when I needed to be, and with that training and knowledge.
I had a similar story. You talk about Dr. Larry Reynolds talking about this Bunyan Bryant guy in environmental justice. Well, when we were getting together in the Flint Water Task Force, he did the same thing. Larry brings in these articles and goes, do you know this guy, Bunyan Bryant? And you know environmental justice? And I did the same thing. So it wasn't 20 years. It was a little bit longer than that I've known Bunyan. But it was amazing that I think for both of us, what a great foundation the SEAS program has really done for us.
Absolutely. And I think part of this book is a recognition that we all stand on the shoulders of giants. We absolutely stand on the shoulders of giants, of those who walked before us, those who walked beside us. And our work, my work today, is impossible without the foundation they have laid. So thank your teachers. So don't forget to go back and thank your teachers, because we would not be here without our teachers. I think that's because my mom was a teacher. I was raised by teachers. And I'm a medical educator,
So it's amazing how much we use what we learned every day, and so I'm so proud to be associated with this school. I was going to name drop about a bunch of the people that I know, in the book, from all the elected officials, the DQ folks, DHHS,
governor,
and the governor, who I got to tell you, when I go see the governor, I can wear a polo and slacks. I don't have to get dressed up, so I'm getting dressed up for you. But anyways, and I said about your friends. But I wanted to just talk about a couple of the special people who I think are in your book. And the first one is Elin, Betanzo. And I mean, what an amazing thing to think about, that here you hold a barbecue dinner at your house, just about the time that Flint, water's starting to creep into, the conversations. And she has this background from EPA and DC and dealing with, lead there. Have you ever thought what would have happened or not happened if Elin doesn't make it to that dinner?
I mean, you can't make up the stuff. I didn't make it up for the book. You really cannot make up the serendipity of constellations that brought this together and really made me open my eyes. So Elin is a high school friend. I've known her forever. She is a drinking water expert. Like, oh my gosh, have friends who are drinking water experts. She worked at the EPA. She worked at the EPA a decade ago when Washington, D.C. had a very similar lead and water crisis. Last minute texting like, hey, are you free? Come over. 2 high school girlfriends came over. Our little kids are playing. My husband's barbecuing. We're having wine. And she corners me in my kitchen. She's like, Mona, what are you hearing about the water? I'm like, everything is fine. The state says everything's fine. I just saw patients in clinic this morning. I told them, they were concerned. I told them to relax. I didn't say relax. Somebody else said relax. I told them everything is fine. How could the water not be fine? How can the water not be fine? How could our tap water not be fine? This is America, right? This is the richest country in the history of the world. This is the 21st century. I talk about 19th century London with cholera epidemics. This is not then. This is Michigan, right? This is literally a city in the middle of the largest source of fresh water in the world. But despite all of that, there's rules and there's regulations and there's people who wake up every day to make sure our water's fine. How can our water not be fine? So we're having this conversation in my kitchen with a glass of wine. And she's like, it's not fine. I'm like, what are you talking about? It's not fine. She's like, I saw a memo from a former colleague of hers, Miguel del Toro, who worked at the EPA. She's like, I know Miguel, and he's warning that there's going to be lead in the water, that if the water is not being treated properly, and because of that, there's going to be lead in the water. So I put down my glass of wine, and my life changed. When I heard the word lead, there was no going back, there was only going forward. Anybody in pediatrics, anybody in public health, anybody in environmental work knows what lead does. I remember Bunyan telling us that it's a form of environmental racism, that our Flint kids were already burdened with lead poisoning, just like kids in Detroit and Chicago and Philadelphia and Baltimore. Our country's most vulnerable children everywhere already had higher rates of lead exposure. And we also now know through incredible science what it does, that there is no safe level, that it can impact the entire life course trajectory of a child. So when I heard that in my kitchen at this last minute barbecue, it was only going forward to find out what was happening with our kids. So thank God Elin came over. So one of the lessons of the story is connect with your friends, hang out with your girlfriends, drink wine, but diversify your friends. So a big lesson of this book is the value of team and working with folks who may be different than you and maybe of different professions than you. So often in academia, we tend to hyper-specialized, and we are in these little mini kind of societies of these people and these people, especially in medicine, we're very hyper-specialized. But you have to make sure that you build a bigger network to be able to kind of tie these things together.
Elin's one of the people who I actually got to meet because of my role in task force, and who's now, to be full disclosure, is a consultant to my organization, and she's fabulous. Mm-hmm. And I can't say enough about her.
She's amazing.
I can't imagine what would have happened in the state, and especially in the city of Flint, if she hadn't cornered you and really opened your eyes to what was there. So all of us owe Elin a real gratitude of thanks.
She's an unsung hero. She's incredible. She is.
And the other one is Marc Edwards. And I loved how you described him and how others saw him. And I've had my own experience with Marc, from talking to him, on the phone, to all of a sudden having the phone way out here because I could hear everything he was yelling at me about. But I thought you painted a really true portrait of him. I mean, from his experiences of going through D.C. and fighting with the federal government, the CDC, that you really, were truthful to who he was. And I kind of wanted to see if you could take us through sort of that first meeting with you and Marc and Elin, and was Dean there as well. But Elin had reservations about reaching out to Marc, and she knew his reputation, but you reached out anyways. Mm-hmm. And when you met him, you had that secret file with you as well. So I could just see you guys.
We're not going to give away all the book details. You have to read the book. You can get all this drama in the book. So Marc Edwards, for those of you who don't know, is the water expert, the environmental engineer from Virginia Tech. He has been battling lead and water for over a decade. So he also covered the Washington, D.C. lead and water crisis which was about 2001 to 2004, and many people don't even know about it, but it lasted longer than Flint. The lead levels were worse than Flint, and nobody was held accountable, and almost every federal agency covered it up. And he brought all of that to light. So when he heard about Flint, through a mom, an amazing mom, Leanne Walters, when he heard that there was lead in the water and the state wasn't doing anything about it, he literally packed his minivan overnight with graduate students and with supplies, and he drove up from Blacksburg, Virginia, which is in the middle of nowhere, to Flint, to work hand in hand with the citizens to do citizen science to find out if there was lead in the water. So they sampled the whole city, and very transparently, they released these findings on a website that there was lead in the water. And he was attacked by the state. The state called him something of a magician, that he would just pull rabbits out of hats. Wherever he goes, he would pull rabbits out of hat. And an interesting side history, he was also involved with Virg Bonero, who was the former mayor of Lansing, but at that time when he was a state senator, he was involved with Virg Bonero when there was noise or evidence of lead in water in the Lansing water, and that's what got Lansing to change their lead service lines over a decade ago. So Lansing is one of the only 2 cities in the country that has replaced their lead service lines, Lansing, Michigan, and Madison, Wisconsin, and that was also because of the involvement of Marc Edwards. Flint will be the 3rd when we finish changing our pipes. So Marc is well known in the water world as being passionate, as being a fighter for truth, for calling out people who lie, and really trying to getting at the bottom of things. So Elin knew of him. She didn't know him. She was also actually an alum of Virginia Tech, and she warned me. She's like, I don't think we should reach out to him. He's really volatile. He might not be the best person for us to connect with. But I insisted. I'm like, he's an academic. I mean, like, what harm can he be? So we met him. And you can see the rest of the details in the book, but it took a minute for me to realize that here's a guy from a different profession of mine who looks totally different than me, politically very different, who probably cares about kids more than I care about kids. He was in it for the kids. He was absolutely in it for the kids.
I think that's the bond you share.
Absolutely.
That both of you were in it for the kids.
And he was fearless. He was absolutely fearless.
He is fearless. He is a unique individual, but regardless of any disagreements that others may have with him, I really would rather have him in my corner than fighting against me.
Absolutely.
So Marc's another unique individual. The other person that I wanted to bring up...
And one thing that he would always say, we were planning for a years-long fight in Flint because of what happened in Washington, D.C., where it took about 6 years. Like, there was cover-up for 4 to 6 years. So he no one ever expected the state to concede. And he calls Flint a miracle. He's like, what happened in Flint is a miracle. He was expecting it to go on for so much longer, for the state to continue to deny, and attack.
Miguel Del Toro. I mean, talk about another coincidence. Leanne Walters has reached out to him. He has a training seminar up in, I think, Bay City or Saginaw, north of Flint. And so on the weekend, he figures I'll just drop by her house. So here's an EPA employee who not only goes out of his way to investigate, but he really risked his career by getting information back to Leanne Walters, took samples of her water, and also to the press. This is another true hero of the story who's underappreciated.
He's amazing. So when you think about the story in Flint, you often think about government failure, people who failed at their jobs at really every level of government, but it also highlights the people that were just incredibly amazing and heroic and brave. And Miguel is one of those folks. He works at the EPA out in Chicago. And when he was contacted by this amazing mom, Leanne Walters, he drove to her house, he tested her water. He even offered to use his own money to find out what was going on in Flint. And he was silenced by the EPA. He was literally silenced by the EPA. And he also suffers significantly from being silenced. But an incredible person who continues. He's still part of the EPA's oversight in Flint.
And then there's so many voices of the residents, in Flint. And without them, rising up, whether it was Leanne Walters, Melissa Mays, all of the residents and mothers who came down to City Hall, who held up those dirty bottles of water, we would never have gotten there. The other group that I want to touch on, we won't go long into it, but just the role that the press played.
Yeah.
Because there's some really, from Kurt Guyette to
Ron
Ron
Fonger,
Funger,
yep.
to even, Michigan, radio.
Absolutely,
here
Lindsay
that-
Smith, yep.
With so seeing the press, as an industry, journalism, fading away, how important was it to have these type of reporters, working the story with you?
So in your report, the Flint Water Task Force report, you highlighted a lot of the failures, but your team also highlighted what worked well and was important. And I would absolutely echo the role of investigative journalists. And it's tragic because we are losing so many investigative journalists, especially these print journalists. If it was Kurt Guyette who was a seasoned reporter. He was working for the ACLU it was the very first time they had a reporter, and they only had a reporter because the Ford Foundation gave them a grant to do some reporting on what could be the consequences of having so many emergency managers. So the Ford Foundation was concerned about what could happen when you take away people's democracy. So they hired Kurt Guyette, who dug and kept digging, and actually in July of 2015 broke this story because he got this memo from Leanne Walters that Miguel had given him. So incredible reporting. Ron Fonger with the Flint Journal probably wrote 260 articles about the Flint water before it exploded. He publicly reported that just a few months after we had switched our water source in October of 2015, that General Motors, which was born in Flint, was going back to Great Lakes water because the water was corroding engine parts. So he wrote that article. So that was public. It was public that the water was corroding engine parts, but the people of Flint were literally told to relax. So he kept digging and he kept digging. Lindsay Smith from Michigan Radio, incredible reporting and investigative reporting. I often say that it was ultimately kind of our research and our science that spoke truth to power and finally got the state to concede when there was that proof of impact, but it was also the voice of the media. If you look at these Google trends of when the national media really started to pay attention, and it was because the media really started to get on the story that things finally changed.
Kurt was really good for me personally when we were doing our review, because he would call me and have you looked at this? Have you done this? And I can remember one day I'm in my office. It's probably 4:30. It's winter. It's getting dark. I'm on it for a half hour with him. I said, Kurt, I got to go to my car to get home. So I took my cell phone, called him back from Lansing to Ann Arbor. He just gave me such great information, questions to ask, where to go, and without his guidance, I think it was, I would not have been as smart as I appeared to have been.
And this is the team that we built, and this is a team that we have to build. It was a team of moms and activists and pastors and journalists and water scientists and community members. It was this diverse team that came together as activists and as resistors, and you got to build that village.
How important it is to really move these issues forward. So I'm going to switch gears just a little bit and go towards, a little forward. You know that you've gotten your preliminary results of your blood lead levels, and you know from those results that the children have been impacted. You've seen that the percent of children with high blood lead levels, the percentage has doubled. Mm-hmm. You know that you've got this information. You must have had some excitement, but also some anxiety. And as you move towards your press conference and your final reveal publicly of your final, research results, what were you really thinking? How was it? Because I know you go on and talk about, curled up in bed, not eating, not drinking. There was sort of a cost to you and to your family. I don't want to say it's minor, but it mm-hmm. doesn't, pale to what happened in Flint. Mm-mm. But what was that like? Can you give us a little feel for what your life was really like at that point?
Sure, and all these details are also in the book in gripping drama. So, nothing can prepare you for what happens when you say something and people tell you you're wrong. And I expected some sort of backlash, because everybody who had raised any concerns about this water was attacked. So the moms were dismissed, the activists, the pastors, the water scientists, everybody who had raised any concerns was denied. So I was prepared for a little bit of that, but nothing can prepare you when almost every arm of the state tells you you're wrong, that your research is wrong, and that their data is inconsistent with your data. So I was called an unfortunate researcher, that I was causing near hysteria, which is probably my favorite term because it's also sexist and it's historically been used many times against women. That I was splicing and dicing numbers, and that the state, who holds a larger sample size of this numbers, because the state has blood levels, that their numbers weren't consistent with my numbers. So for a moment, it was hard not to believe them. I thought I screwed up. I'm like, what the heck did I just do? Not only did I lay, my career on the line, and what was I getting into? I'm not an expert here. Like, what was I thinking? I should have just stayed in my bubble of being a pediatrician, a mom, a wife. Why did I have to get out of that bubble and take this risk? And then it was a very quick realization that who cares what happens to me? This is nothing about me, absolutely nothing about me. They can come after me any which way they want. This is everything about the kids. And as a pediatrician, I literally have taken an oath to protect these kids. These kids are no different than my children. This had everything to do with the kids. And we also knew our science was right. We had ran the stats. We had checked and double checked and triple checked. We knew the numbers were right. But we didn't even need my evidence. The evidence was already there. The science had been dismissed for so long. Corroding engine parts. I wonder if the water is more corrosive. Lead in the water. Oh, there's lead in the water. Yeah, it's going to get into our kids as well. So the numbers, so it was the realization very quickly that the numbers that they were dismissing weren't numbers. They were children. And children that I had been entrusted to care for, and a child I'd probably cared for within that last year or so. So that's kind of what got me back in this fight and got me kind of energized, and we fought back with more numbers and more evidence and more science, and finally the weight of that got them to concede.
How did it feel when the state finally, admitted that they were wrong?
It didn't feel good. Part of me, I wanted to be wrong, because if I was wrong, then this wouldn't be a problem, I wanted our research not to show anything. I knew it wasn't going to because of all the basic other science that was dismissed, but I wanted to be wrong, because by being right meant we did have this serious crisis.
You had a meeting with the governor, sometime after that. I thought, one, you were very descriptive in talking, about him walking in. But for me, I think the most interesting aspect of it is that, near the end, you forgave him. And I thought that was probably one of the most powerful moments in the book for me, and this truth and reconciliation that's a concept that's out there, but we don't always embrace it. And I just, personally, I'm not sure I would have done it, but I was really moved reading that passage.
So I'm a pediatrician, I'm not a prosecutor, and there's people whose job is to figure out what happened and who knew what and when. My constituency is the children, and I will do whatever and talk to whomever and work with whomever to make sure that our kids in Flint have everything they need. So I have to work with him, I have to meet with him, and you got to give him credit. He did concede, and nobody expected the state to concede. Obviously, it was too late, it was too little, there's so much more that needs to be done, but it could have been a lot worse.
And they did come forward with money. Your whole secondary prevention programs, focus on nutrition, public health, and education are a potential model for the rest of the state and nation.
Yeah, and that is why one of the reasons I wrote this book. Yeah, it is to share the lessons of this terrible crisis. It is to share the power of activism and resistance, but it is also to share what we can do to build hope in our communities. And that is what we are doing now. Flint is not going to be defined by this crisis, but rather by our recovery. And what we are doing in Flint right now is not being done anywhere in the country, not only in terms of our pipe replacement, but also how I get to spend my every day, which is caring for the children. So we are leaning on amazing science, the science of brain development and child development and toxic stress and resiliency, and we are wrapping our kids in Flint with everything to promote their development, everything that science tells us is good for kids. So we have 2 brand new child care centers, massive expansion of home visiting programs, early literacy. So this is a big part of our work. So kids in Flint and places like Flint, there's about 1 book for every 300 children. Think about that. 1 children's book, not like my book, but a children's book. There's about 1 children's book for every 300 children. By the time our kids reach the age of 3, they have heard 30 million less words. By 18 months, you see evidence of that achievement gap. By kindergarten, it is too late to bridge that gap. So books are important. So we came together as a city. Flint's a small, big city. We all came together. I got a small grant. We launched something called Flint Kids Read. Now in Flint, every single kid gets a book mailed to their house every month from the age of 0 to 5. 5,000 kids are in that program. In pediatrics, we have this long-standing evidence-based program called Reach Out and Read. We only had 1 clinic doing that in Flint. Now we have over 10 clinics doing that, where kids at every well visit get a book. We have a program called Born to Read. When babies are born at the nursery, they get a bundle of books and developmental toys and early intervention support. My publisher, who is so invested in Flint, has donated 5,000 children's books. So literacy, we've massively expanded and are serving as a model of what you need to do to promote early literacy to ultimately improve kindergarten readiness, 3rd grade reading, and ultimately child outcomes. 2 brand new child care centers, 500 kids who now have access to year-round, high-quality child care, which is amazing, and this is the period of the most robust brain development. We have mobile grocery stores because there are no full-service grocery stores in Flint. My clinic is on the 2nd floor of a farmer's market. Every single kid, no matter if they come in for an ear infection or a well baby checkup, gets a nutrition prescription for $15 that they fill downstairs in our farmer's market. It's awesome stuff. One of my favorite programs is Mindfulness. So hopefully you're aware of mindfulness and yoga, and it's used to kind of limit stress and anxiety, and it's even been used in school districts to increase performance and decrease absenteeism. All of our Flint schools now do mindfulness, all the kids, and we're even getting that down to the early childhood level. School nurses, we used to have 1 school nurse, now we have over 10 school nurses, and that was in our first state ask. So the list goes on and on and on of the awesomeness that we are doing in Flint, the model, kind of state-of-the-art kind of innovations that we are doing for children. But that's great, but that's not enough, because every single kid everywhere needs these things. So what we are hoping to do in Flint is really to share our best practices with our very academic, data-driven hats. There's kids everywhere there's Flints everywhere. There are kids everywhere who are waking up to the same nightmares, the same toxicities, be it lead, be it poverty, be it racism, discrimination, crumbling schools, you name it. So we hope to share what we've been able to do with kids all over this country, and that's definitely one of the reasons that I wrote this book.
No, it's perfect, because that's right out, it's not in my bio, but right out of the legislature, I worked in early childhood.
Awesome.
And the things that you were doing were right in line with what they said you really need to do for kids to be successful. So I really think it is a model we need to roll out in this state and across this country. You've had some time to, since writing this book and all your speaking engagements, give you just a little chance to riff on, what do you see was the real cause of the Flint water crisis?
So once again, there's ongoing investigations, there's ongoing efforts at accountability to figure out what the real cause and who's accountable, and that's important. We need all these efforts of accountability because that gets at that truth. There needs to be a role for reparations and restorative justice, and then we can really get onto that path of reconciliation. So those are ongoing, the trials and all that's ongoing. So what was the real cause? So people like to, identify villains, and you guys can name villains in the story. But what I kind of describe in this book is that The villains are really ideologies. They're the ideologies of austerity. This was driven by austerity. It was driven by greed. It was driven by environmental injustice and racism and discrimination. There are the lack of democracy, disrespect for science. It was these ideologies, these beliefs that were the real villains in the story. And that's why this story resonates with so much of what's happening in this nation. Flint very overtly lost democracy. We were under emergency management, but there's communities everywhere that have lost democracy through voter suppression, gerrymandering, mass incarceration. This is happening everywhere. Environmental injustices, we've continued to happen everywhere. The disrespect for science is happening right now with climate change, the regulations that protect the EPA and these our air and water regulations, immunizations. So these are lessons, and these are villains that we see right now that we all need to wake up to and address.
Thank you. This is exactly where I wanted you to go with that question.
Good question.
So I have a million questions, but we're getting close to the time where we want to open up. So I'm going to end with this question, and I started this by saying that your book opens with family and ends with family, and I want you to really, can you tell us or tell me, why you ended your book with the story of Haji and the birds? Because I want to tell you that I found the ending to be very warm and very moving. It brought back so many fond memories from my own childhood and just my parents reading to me. But I think there's other messages there as well. So just give us just a little take as to why that story, why you had to talk about Bibi, telling the story to your kids, and why it was so important.
Yeah, so you'll read it in the book, but this is how I end the book. It's a story, it's an oral history story that's been passed down really through generations in my family, called Haji and the Birds. Haji, well, Asafir in Arabic. There's a lot of Arabic in the book. There's also a lot of Arabic food and a lot of Arabic history. One of my favorite other stories in this book is about my great uncle, Nouri, who left Iraq in the 1930s to fight in the Spanish Civil War as part of the International Brigade. He was fighting with the Lincoln Battalion with the Americans, like fighting fascists in the 1930s. So lots of really cool family history and family stories in there. But my favorite story, which I ended with, is a story that my grandfather used to always tell me about a time when he was in his garden and he was picking flowers or dates or something, and he fell off and he broke his leg. And there was nobody around. And he was good friends with the birds in the garden, and every day he would go out and feed the birds, and the birds came to him and said, we'll take care of you. And he laughed. He's like, you can't take care of me. And then one by one, they picked him up from, and I could see him telling me, he's like, they picked me up from my hair and my nose and my ears and my cheeks and my shoulders and my chest. And this kind of magic carpet of birds lifted me across the silhouette of Baghdad and to the hospital, where I was cared for by a doctor and eventually recovered. So there's many iterations of the story, but for me it has many lessons. It's about the importance of medicine and doctors, and the doctor was always a woman doctor when I thought about that doctor. But it's also about believing that the impossible is possible. It's also about the value of working together. My brother, who's part of this book, is a labor lawyer, and he taught me a lot about Flint's history, its labor history, but what you can do when you're in solidarity with your brothers and sisters. That's also part of that story. So there's a lot of kind of different lessons, but I like it because it helps me continue the traditions of oral history that were such a big part of my life. I got to record the audiobook for this book, and the best part was being able to speak the story, to be able to literally continue that oral tradition.
Well, thank you.
Thank you, Chris.
Thank you for not only tonight, but thank you for all you've done, in Flint and continue to do, and for giving us this pleasure to be here with you, and me being able to be a part of it. So thank you.
Thank you so much.
Thank you. We are now going to open it up for question and answer. If you are a student and you have a question,
You get to go first.
right, and you can move to one of the microphones or the microphone on the left, your left. And if you are not a student, but you have a question, you can ask from a microphone on the right. So let's go.
I have a bunch more.
And you're taking the microphone in the center. So what's your question?
So you're a grad student or something? That's just
My name's Molly McNeely. I'm a first-year medical student here at U of M. And I was wondering what advice you have for a young woman about to enter the profession.
So there's a lot of research on what happens when you progress as a physician. So you enter medical school and you are altruistic and you went into this profession because you wanted to help people. And research shows that as you progress through your training and your career, you become jaded. You get obsessed with billing and coding and revenue and ICD-10 and how many patients do I have to see an hour. So the advice that I would give to you is stay true to why you went into these careers. Keep your passion. Always remember, stay grounded in why you are doing this. For me, being a pediatrician is not work. It is a privilege. I love waking up every day because I get to hang out with the cutest, brightest, smartest kids ever. And they're the ones that give me energy to keep going. So find what you love and do it with your heart.
Thank you.
Thanks. Microphone on
Yes,
the...
hello. My question has two parts, and I haven't read your book. So the first question is, lead is the best-known neurotoxin, and the symptoms of lead poisoning have been known since Roman times. Flint residents described having hair loss, hair falling out, there's skin rashes, and rotten teeth, not dental caries, but teeth that were just falling out, I guess. Did you see none of these symptoms in kids that came to your clinic? And the second part is, it's clear from what I heard Marc Edwards' talk at the School of Engineering that was sponsored by the School of Engineering, and it's clear to me that everyone in Flint wasn't drinking water with lead in it. Was your family drinking this foul-smelling, foul-tasting water? And how was what part of Flint was actually drinking water that had high lead levels, and how many percentage-wise, and how was it something to do with, I'm sure it probably had to do with economics and with economics. We'll leave it at that. Am I being coherent at all?
Yes, I think so.
Yeah, right.
All right.
All right, so your first question was, what were you seeing in your patients, or were you seeing all these things? And I talk about this in the book. This is the difference between individual care and public health, population health. I can see a bunch of kids with skin rashes or high lead levels, but I, as one physician, can't make the connection at a big level. And that's why you need surveillance programs. That's why you need the field of public health. Mm-hmm. Your second question was, everybody impacted the same, or where was the... So it varied. Every home was different because it depended on the service line going into your house. It also depended a lot on your interior plumbing. The plumbing inside your house is called premise plumbing, and that can have lead in it as well. Lead in brass fixtures wasn't eliminated until 2014, but a lot of the older homes had the lead service lines, which are the water lines that go from your water main to your front of your house. It depended also on where in the city, and that kind of correlated. This was one of our second research projects. The worst areas of the city where we had the highest water lead levels, the greatest increase in children's lead levels, were the oldest parts of the city that had the longest water age, which meant it took the longest time for the water to get from the treatment plant to that part of the city because it had most contact with the corrosive water. So there was a lot of variables that changed who had high lead and who didn't have high lead.
Okay, that was really helpful. Thank you.
student question, and just in the interest of getting as many questions as possible, could we keep the questions short and precise and succinct? No pressure. No pressure.
None.
You're awesome. You can do it.
Hi, Dr. Mona. First and foremost, thank you again for being here, and just thank you for your advocacy and passion for people. It is inspiring. So I'm a first-year second year now.
Yeah,
it's just
you made it. You made it.
It's so new. So my question for you is this: at the time when you did realize there was a problem, right? But you're still seeing patients in the day-to-day. What are you telling them? And the reason why I ask that is because I think about medicine as it exists with public health as this microcosm where there's something that you know is wrong, but there's a lag time between being able to do something about it in terms of the populations. And so with your patients, knowing that the more exposure they have, though they have to take baths, they have to drink water, knowing you can't necessarily say just move to another city, what are you actually telling them in the interim between knowing there's a problem and kind of the actualization of the community that you're working with?
Yeah, so I was governed as a medical professional, but also as a public health person with training in both. I was governed by that precautionary principle: err on the side of caution. So when I knew that there was lead in the water, every patient interaction from that point on was that of precaution.
Thank you.
You always err on the side of caution, especially when kids are involved.
Hi. I guess given the direction the country has gone in the past 30-some years in terms of economic inequality, and then also the last couple of years in terms of what we've seen politically, and kind of a return to tribalism, a return to more overt racism. I think what you've been doing in Flint is kind of a miracle. It's great to see the changes that have been enacted, especially in terms of early childhood. But do you have any advice for how not to just be completely cynical about the whole process? Because it's just kind of a day-to-day grind.
Yeah, so we are in a very difficult time in our nation right now. And that is why I think this book and this story is so important, because we were in the darkest place at the darkest hour, and we were able, through activism and resistance, to shine light and bring hope. And that's why I think this story resonates everywhere. So I was at the premiere of Michael Moore's movie on Monday, and somebody asked a very similar question. And it's all about, turning that hope into action, doing, not just being angry and depressed and the world is falling, the sky is falling, but getting out there, voting, get engaged, running for office, getting other people elected, being civically engaged. What happened in Flint was a disrespect for people. We lost our very civic and human responsibility to care and provide for each other. We closed our eyes to this population. And that's what we see happening right now. It is on us to open our eyes and to care and to provide for each other and to speak up and to be involved and active.
So just
Thank you.
get off your butt and do something.
Hi, my name's Jen. I'm a first-year MPH Global Epi student. And I also, an undergrad, and until coming here, was really involved in social engagement and activism and protesting at any point. And now I find myself in this academic setting where it's strictly publish or perish, and you need to stick to the words, and you only have your small comment section at the end of the paper to say what you really want to think. So I'm curious how you think a young professional can blend these without putting kind of our work at risk, and knowing that we want to say what is just and what is right, but we have limits to what we can say.
Absolutely, and that is definitely addressed in my book. It is, what is the purpose of science? Is science not to benefit society and the human condition? Science is not meant to live in journals and publications and be there for promotion and tenure. That is not the benefit of science. So how do we get out of that box. So we released our research before the peer review process. So academics, that's like, oh my God, that is like such a no-no. And I received an award from MIT called the Disobedience Award for doing that. So that was like the hardest thing to explain to my children. Like, I just got a Disobedience Award, but like, go to bed right now. And then I was also involved in the March for Science movement, and it was all about the need for academics, for scientists, for doctors to get out of your ivory towers and your classrooms and your hospitals and exam rooms, and to work hand in hand with your community and to translate your science for that better good. Science has a better place. So be loud, be stubborn, be persistent, and go to a place that will support you. Like, I am purposefully in Flint, where I am, in the position that I am, because I'm in a community that supports this kind of work and values being community engaged and community participatory and working on these kind of issues. So also make sure that you purposely put yourself in those places too.
Can I just, there's another part of your story is that there is real power behind science and research, and part of why Mona and the residents of Flint were successful was not only for their collective action, but for the use of really directed research that said, state, you're wrong, there's something going on here, and we have to do something. That finally pierced that veil of denial, and it just focused your research on something that's going to have an outcome that you believe in. And there's so many projects from Bunyan Bryant and Paul Mohai, environmental justice, to lead in drinking water, because the profession and public health officials don't believe that lead in drinking water is a problem. There's so many research capabilities out there. Just have meaning.
Yeah, and ultimately it was two academic researchers like myself and Marc Edwards who had the academic freedom to be the checks and balance for government. So we were both from land-grant universities. Both of our universities really had that mission of service and being community-based. So it was academia that played an incredible role and continues to play an incredible role in Flint.
Thank you.
Agree.
Hi, Dr. Mona. My name's Paul, and I am a middle school teacher.
Awesome.
Yes, and so...
my daughter's in middle school. I love middle school teachers.
That's great, yeah. So I'm a little tired, so this might not come out the way I wanted it. But
hormones, yeah.
I read your book this summer, and I really found myself kind of inspired to go back into my classroom and to kind of instill some of the values that I saw espoused in your book. But I was thinking about a relative of mine who actually worked for the Flint emergency manager and was a great guy, was a great person, but yet suddenly found himself kind of, pictures on the internet of him drinking the water in the PR stuff, and then thinking of my students who are great people, very kind, very many of them talk about wanting to become doctors or different professions, and I'm thinking, what are the lessons that our kids need to learn in order to, when they're faced with sort of times of crisis and times when that courage and maybe disobedience is required? What are the lessons that they need to learn?
Yeah, that's a great question, and that's something that I try to share often, and definitely a message of this book. So it is scary to step out of that box. Like, it was so easy for me just to keep doing my job, minding my own business, like just believing everything else that was going on. It was scary. It took a risk. There was a lot on the line, but ultimately it was the right thing to do. It wasn't the easiest thing to do, but it was the right thing to do. And that's what we all have to be guided by. So when you look back at your life, when you are 80, 90 years old, and you look back at your life, you're not going to look back at those moments and say, oh, I'm so glad I stayed silent during that crisis or that part of American history or whatever. I'm so glad I didn't get involved and didn't get advocate. You are going to cherish and value the moments that you took those risks, that you stepped out of the boxes, that when your heart rate went up, that when the times when you stopped eating and you had a knot in your stomach that wouldn't go away. Those are the times that are going to help you grow and create change.
Thank you.
Great, thanks. Let's see, we have, I think, 6 more questions.
My name is Paul, and I'm very curious as to how the solution came to get the clean water in small bottles. how you could, here's your case of water for the day, and you've got them in these little tiny bottles. How did that happen? Or did the tribe people go nuts with that? And the litter from all those plastic bottles?
People are still
Is that
on.
the best we could do?
Flint is still on bottled water and filtered water. We are still in a state of public health emergency 4 years out as our pipes are being replaced. And that is the everyday. People are bathing their babies in bottled water. They're cooking their food with
Could
bottled
they
water.
get a 6-gallon carboy or a water truck go by and
Yeah,
whatever?
wouldn't it have been great if we had there's things called like water cows and other these, big capacity, but that never came. That was asked for and that never came. So people were stuck with water bottles, and now the state has even cut the supply of water bottles.
Great, we have to go
Thank
to
you.
the next mic. Thanks.
Okay. Hi, I'm Jenna. I'm a freshman at University of Michigan, and I was wondering what
Go
you thought.
freshman.
Yay! You just started. Awesome.
And I was wondering what you thought the future of activism was, especially considering we live in such a corporation-driven society.
I mean, I have never seen so much activism as what's happened in the last 2 years. At one point, there was like a march every weekend. So there's activism, there's resistance, there's the Me Too movement, there's the March for Science. There's so much stuff happening right now. You would be blind if you didn't find an opportunity to get involved in something that you cared about. So I think it's bright. I think it's positive. The activism so far has already changed outcomes. So there is a critical role, just like it's shared in this book, of being an activist, being a resistor, and being disobedient.
You're great. Be disruptive.
Yeah. Mess with your professors. Just kidding.
Hi, I'm Kristen. I'm also an undergraduate at the U of M. This is actually kind of a follow-up question to the one she just asked. But I'm wondering what strategies you found most useful in convincing people of the ideas you had, like are facts or feelings better, like passion or conciliatory tone. I guess that's the question.
So the question was like, what strategies did I use to convince people?
Right. What do you found most useful?
Yeah, most useful. I think it was when I always just had my pediatrician hat. So I'm a pediatrician, I'm an expert on children, and this is what kids need, and this is what it's doing to kids. It would have been, sometimes it was so hard to not yell and scream and get political and like, oh, I got really ready. But I tried to keep myself grounded, remind myself every day what my constituency was, which was the kids, and what's always best for them and what they need. And I think that's how I have kept my credibility, is being grounded in that role. And this is all based on science. Science tells us this is what happens to kids. This is what's happening. This is if we don't do anything, this is what kids need.
Thank you.
Thank you.
Hello, doctor. You face tremendous forces of apathy, of ignorance of the law and science, and sometimes avoidance of law and science. Can you tell us a little bit more about how you dealt with that and how you remained hopeful in the end?
Yeah, so, when we shared this research, there was a lot of resistance, a lot of people who didn't care, a lot of people who just wanted this to go away, just like everybody who had raised concerns. And I think I've always been really annoyingly stubborn, There's a part in the book where, of a kind of funny dialogue between me and my husband, he's like, you're the stubbornest person I ever knew. Yeah, I know, you never give up.
And you said, no, I'm not.
I said, no, I'm not stubborn. I'm like, yes, you are stubborn. I know, yes, you are
Mom,
stubborn.
Dad, was she stubborn?
Dad's been nodding his head yes.
So it's just
see you,
persisting. It was the persistence and the persistence and the persistence, and enlisting more folks who also felt the same way and believed in me and believed in the data and believed what was happening. So right when I had the preliminary numbers, I called my buddy Dr. Reynolds, who's also a pediatrician, a credible member in the community. I'm like, I need your help. He got on board. I was on the board of the Michigan chapter of the American Academy of Pediatrics. They got on board. So more and more folks, our health coalition, our medical society. So it was once again building that team and building that network of folks that could continue to persist with me. And also, we didn't mention, so the other heroes in this book are our elected officials. So State Senator Ananek, Congressman Kildee, Senator Stabenow and Peters, they had my back at every level of government. When the state was dismissing me, the EPA was also dismissing me. Congressman Kildee was fighting with the EPA. No, she's right. Her data is right. And once Senator Stabenow and Peters got involved, they never stopped fighting for Flint. So it was enlisting this larger army.
Great. Next question.
Hi, Doctor. I'm a third-year hydrogeology student, and you mentioned a couple
Go
of times...
hydrogeology!
Yeah. So I took that geology course at camp. I love geology. It's awesome.
Jackson Hole.
Yes.
But you mentioned that it took and is taking, I imagine, people from all sorts of fields, from scientific fields in multiple different sciences, community leaders, activists, elected politicians. I was just wondering, have there been and are there still communication issues between all these different fields?
Oh, absolutely. It's a big problem, and what we're also seeing in Flint is the academics are arguing with each other. Oh, the filters are good, the filters are bad, or this is really not a problem, it is a problem. So that creates even more issues with risk communication. We also have some nuanced populations. Not only do we have high rates of poverty and high rates of illiteracy, but I'm going to quiz people. I think, what do you think is the most common second language in Flint? Not Spanish. Not Arabic. It's a trick, it's sign language. So we have the largest deaf community in the state is located in Flint because the school for the deaf for the entire state is in Flint. And they were probably one of the last populations to know what was happening. We also do have a small Spanish-speaking population, and forever they were boiling the water because isn't boiling water the best thing to do? But boiling water is the worst thing to do when you have lead in water because it concentrates whatever you're cooking and the food you're making. So that macaroni and cheese you're making for the baby, if that water that has lead in it, it goes into the macaroni and cheese. So we actually had to put billboards in the Spanish-speaking communities in Spanish, do not boil your water. So there are ongoing issues with risk communication and getting messages out that has not been resolved.
Thank you. Last two questions.
Hello, my name is Elizabeth. I'm a freshman in the LSNA. Currently
Freshman!
Woo,
awesome!
I'm currently interested in the major biology, health, and society. And my question is, whether in high school or in college, was there a specific area of science you enjoyed the most? And if so, how did that translate into what you ultimately ended up studying and what you're doing now?
So all of it. So I loved sciences. I went back to my local grade school for an event, and they dug up my yearbook, and I won like Best Dissector Award. So I guess I loved anatomy too, back then even. Then I started dissecting humans, whatever. I took geology, I took woody plants at the School of Management, so all kind of sciences, but I also loved English and creative writing. It was here in LSNA that I took so many creative writing classes, which came in handy. And I also took Arabic language, and I took policy classes, and so don't just stick with one. If I can give you any advice, broaden your horizons as much as possible. So I could have graduated here from U of M in 3 years because of AP classes, but I just chose to stick around for 1 more year and just to have fun with it and have fun with the classes and sorry to the tuition with my parents, but take classes and subjects you think you'll never use because you never know when they'll come in handy. I'm glad I took a class on environmental injustice.
Yeah.
That came in handy. And creative writing.
Thank you.
Hi, thank you so much for your courage to come forward and do something about it. That's really incredible. I'm a longtime medical researcher, and I do writing myself. And to me, it's very clear that you were meant to be where you were at the time you were there to do the mission that was prepared for you, in my opinion. My question is, you can't go through an experience like that and not learn something about yourself. What did you learn, and how did that change you?
Don't have any more barbecues.
No more wine with girlfriends. I think I've learned so much in this whole ongoing kind of issue. And I think what has resonated is something that, as mentioned before, and you know, writing a book is a very reflective process, especially because this is very much a memoir and has so much family and just history stuff in there too. And what has resonated with me and what it's made me remember and force myself to recognize is really how I got to be where I am. Like I was, you know, the right person at the right place with the right team at the right time to be able to do this work. I mean, like there was so much serendipity, but it came by being prepared, by having that right training and having that right education and that right foundation. And it is once again a reminder that you know, we are products of our environment, of the people that made us who we are. And I am again very grateful to all of those folks who have made me who I am, and many of them are around here right now. Thank you.
Well done.
So I'd like to thank all of you for listening this evening. And just to summarize, we heard some really important themes. The first is persistence. And Mona called it pig-headedness. It's persistence. And I used to be pig-headed, and I used to get into trouble for being pig-headed.
Oh, I got in trouble all the time.
But that pig-headedness or that stubbornness has a place. And it has a place to help you go and dig for something. Everybody's telling you, no, you're wrong, no, it's not gonna work. But you know instinctively at that gut level. So the second piece is trusting that instinct.
Yeah, trust your gut.
Trust that gut feeling that's telling you to go someplace, do something. The third is focus. So it's all related pieces that keep you, with all the distractions, keep you going. Fearlessness. Yes, there are going to be times when you're afraid. Yes, you'll probably go into your room, you cry, you look into the mirror and say, what am I doing? But you come out and you pretend that you are the baddest blank. But you come out and you project that you're not afraid, because if you're speaking for babies who can't yet speak for themselves, you have to have that peace with you. Believe in yourself. You have to believe that what you're doing is right, that you were put there for that reason. You can't explain why it is you invited 2 friends from high school who come into your house to tell you that your life is going to change, without telling you your life is going to change. But you have to just follow those moments. And I have on my Rachel Carson pendant because I got this this year for being a bad woman in conservation, so I thought I'd wear it today. But Rachel Carson is also kind of one of my heroes. And when she was writing Silent Spring in 1962, she was called a hysterical woman. You don't have any children, so how the heck can you be talking about future generations? She was disparaged. She did not have the support team that you had behind her. But as she was doing that and studying pesticides and talking about the impacts that pesticides were going to have on human beings, well out ahead of anybody else, she said, there is no other side to the story. Yeah. And so there are times that you need to believe that there is just one side to the story, and that's the side you're focused on, that's the side you have, you're on the right side. With that, I'd like you to just stand one more time and give Dr. Mona Hanna-Attisha a hand.
Great job.
She will be out in the front to meet and chat with you, and I'm sure sign a few books. And thank you again. Safe travels home, and we continue the fight and we continue the journey. Thank you.